It's entirely up to you.
So
And what your needs are.
Fasting can mean drink, go for liquid food lah. Don't eat the solid food lah.
No, fasting means except for water, you can take. You don't take anything.
Oh, liquid food also cannot. Milk or
No,
what?
no.
You can go some of the campaign. They do some campaign or camping.
No, the reason is people discover this because when they look at mice that are fasted and mice that don't fast, those that are fasted live longer. And mice lifespan is very short, so you can tell very fast. That's the science behind it. Okay, shall we start the talk?
Okay.
Yes.
Okay, let's start the talk properly. So we are talking about this. What happened?
I think the connector.
Okay.
So I'm talking about the scientific evidence. So you hear a lot of stories. Why stories are not enough? It's very simple. In the 60s, a group of patients were given a medication and they were told this medicine will cure, or this happened to be liver cancer patients. Okay, they told them this medicine works. It will kill your cancer. So they were given medication. And they believe it. And they were free from cancer for many years, 6, 8, 9, 10 years. You know? And this happened. Now, to cut this long story short, they were not given any specific medication. The medication they were given were blanks, placebos. They believe it and they were free from cancer. Later on, when they were told it was not, suddenly the cancer come back and killed them. The placebo effect is real. Okay? The power of belief is real. Okay? So if I believe there's ghosts, there are ghosts. In psychology, we call it a confirmation bias. Right? If I see a blackbird and I say the blackbird means misfortune, so I see several blackbirds, nothing happened. Then one day a misfortune happened and a blackbird happened. That proves it. That's a confirmation bias. So because of this, it's not enough that we have stories. We need the science behind it. So this Hippocrates says if there's a way to hit the bone. And in fact, Hippocrates has a way of treating. In those days, they don't know much about medicine, so they use all kinds of things, including bleeding, including using heat. And of course, who use the most heat to treat and heal your conditions? Do you know? You don't know? I'm sure you've seen one.
Sun.
Huh?
Sun.
No.
Not the sun.
Physiotherapists. Have you been to a physiotherapist? Physiotherapists are the ones who use this kind of devices.
Infrared?
Yes, infrared, near infrared devices are on sale on Amazon from few $100 US to $1,000 over US. It heals.
Oh, okay.
So THz waves is far infrared. It's far infrared. We can't study it because it's pretty unique in its position, as you all know. Then future medicine will be the medicine of frequencies. Albert Einstein says that. And this is very important because everything has a frequency. You heard of the singer who sing and the glass cracked, soldiers march across the bridge collapsed. All this has to do with frequencies.
Oh.
It's true. Everything has a frequency. You see? Cells have a frequency too. In fact, you go to YouTube and say healing by frequency, you find all kinds of frequencies tried, including middle C, including all kinds of frequencies have been tried. And it works. Music therapy can be said to be frequency also, isn't it? Huh? So we're talking about THz, and THz is a very advanced technology which only comes on in the late 90s and the 2000s, this century. And it's in this area: health, science, military, agriculture, and communication. You see? So I'm not talking about military, agriculture, or communication. In communication, 6G is THz.
Oh, wow.
Yes. 5G is towards the electronic waves, the radio wave side, you know. So this is very advanced technology indeed. Okay. So where does terahertz stands? You find that now the red and the blue here is visible light. Okay, what you see, visible light. I saw a video on YouTube. This Chinese scientist who was at Harvard, I believe. He was the one who had made a breakthrough discovery about light. Technically, light is made up of photons. Okay. And as you know, you heard of electrons, you heard of protons, neutrons, and all that. So these are all what we call quantum particles. Okay, and light is photon. The study of terahertz, especially in the field of medicine, is called biophotonics. It's the study of light. So terahertz, as it gets emitted, it is photons. So that's very unique. Huh?
So it's photon, it doesn't ionize. Different
Photon,
kind
what
of
you the light is photons.
light doesn't ionize.
Is photons. Yes.
I thought you said terahertz doesn't.
But photons
doesn't
get
polarize.
reflected. Okay? It doesn't penetrate. As you go towards microwave and so forth, you find that waves that are longer become microwave and radio waves. So terahertz shares out the characteristics of microwave, being able to penetrate, being able to agitate and heat up. But like microwave, it doesn't cause whatever is being heated to be ionized. Whereas ultraviolet does be ionized.
Does
X-ray
infrared-
certainly.
Does infrared ionize?
No, doesn't.
Insert doesn't. Or this part, these two doesn't.
No.
The rest does.
The rest on this side, yes.
The side also does.
X-ray, ultraviolet, all
Then this
can
microwave.
ionize. No, it doesn't. That's what has been discovered. We know that it's very safe. Okay? Because it is so safe, that's why people start to experiment with it. Because it has all the properties, and that's what I'm going to talk about. So it does not damage biological tissues. You see? And it can penetrate. There are two kinds of penetration. It penetrates materials with dielectric. Dielectric means insulating property. Absorbed by polar compounds, which are, if you know chemistry, polar compounds are those with a positive cation and negative cation and positive anions. Okay? Now this is very important. You can be inside the room, I can shoot a beam of terahertz and you can pick up inside the room. Because the wall is non-conducting, so it can go through. The minute it hits something conducting like water or metal, which are conductors of electricity, it gets absorbed. It's the same as X-ray. No? X-ray get absorbed by the bones, so that's why you can see the bones. Your soft tissue is black, it goes right through. See? Energy corresponds to hydrogen bonds and van der Waals forces. You've heard a lot about alkaline water and all that sort of gas. To cut a long story short, when you try and pour water out of a glass, you pour all the water out, you look at the glass, there's still water inside, right? They all cluster in bubbles. These are called surface tension. The surface tension is due to these forces. It binds the molecules together, hydrogen next to oxygen, and these forces are called van der Waals forces. Alkaline water, this force is broken. Okay? So how long this stays is a matter of what caused them to break up. Okay? So it can be as short as a few seconds. Some claim that it can be longer. I don't know. I'm not a physicist. I'm not an authority on that. But that's what it is.
The alkaline water break the van der Waals.
Yes. So
So it doesn't
it
cluster.
distributes. It doesn't cluster. I mean, those of you who've been to some of these alkaline water talks, you have seen the slides of those. So I don't want to go into that. It's absorbed differently by various biological tissues, and that's very important because, like the skin or the bone or whatever, there are many layers, and actually, THz is able to differentiate between all the layers, and that's pretty unique.
I mean the bone and the skin, all that absorb THz differently. Even though it's
Bone
the
has
same.
calcium,
Ah.
it's an iron, so it will absorb. It's a polar compound.
Yeah, compared to skin, absorb different because it's not, it's no
Skin
bone.
has water. Water is a polar compound.
So it absorb.
Yes.
But they
So
absorb
different
differently.
tissue will absorb differently. It absorbs differently because different parts of the skin have different characteristics. So you will have a picture. You see?
Absorb more, absorb less.
Yeah, maybe allow Dr. Kong to finish the, jot down your
Absorb
question.
more
later.
or absorb less depends on the kind of tissue. Different kinds of fat have different absorption coefficients and so forth. So, unless you want to go into technical details, I don't think I want to go into it because this is not the kind of audience I would want to do that. Okay? So, that's why different tissues exhibit different absorption spectra. That's exactly what I'm trying to say. With opaque tissues, THz waves show as scattering. Scattering, rarely scattering is like when you shine light on something, it reflected out. That's exactly what it is. So it behaves like light. That's why it's under study under photonics, which is a study of light. Makes sense now, don't you? So as far as medical, that's what I'm concerned about. Medical applications, there are two big group of applications for THz. One is diagnostic devices, where it can be as huge as this machine, or can be as small as a device that project THz waves, and therapy devices, which is what we have. Going on. So I'm concerned only with medical. I'm not concerned with other aspects. And medical also, I'm not concerned so much with diagnostic, but with therapy devices. Okay? So a lot of things that we learn about the use of THz in therapy devices comes from the diagnostic devices. And because of their penetration, their use in communication, in security, help us to understand why it's powerful in that
you come with me. You come with me.
So, as we say, the cell resonates at a particular
I slowly. You come with me. You come with me. You go inside. You go inside first. You go inside.
And
first.
that frequency is about the same. Now, THz frequency is quite wide. THz frequency is quite wide.
No.
And of course, we don't know this information. Our devices, the THz can resonate at a particular frequency. I don't know this, but I know it's probably around there because those frequencies have been tested in the research papers. So this frequency corresponds closest to the resonance frequency of the cell, and that's why it's so effective. It's a combination of Chinese and Western psychology techniques. Well, Chinese believe in meridians, in energy medicine and so forth. Western in quantum techniques and so forth. Okay? So THz will resonate your normal cell. So this thing has been around for a long time, and these are what we have now. Do you understand what is THz, quantum and optical force technology? Not many people know what this is about, okay? So I will explain. THz technology is what we're talking about, the effect of THz waves. Quantum technology is, this has to do with quantum particles, electrons, protons, neutrons, photons, which is what it's about, are quantum particles. Optical quartz technology, there are many ways to generate terahertz waves. My understanding is that in this device, it is generated by UV light, which is then diffracted using certain crystals, quartz crystals. That's why it's called optical quartz technology. Okay? So depending on the way the quartz crystal is cut, it can produce different kind of waves. So this is cut in such a way as to produce terahertz waves. Now if you drop it and you broke the crystal, it cannot be used anymore. So that's what it means. There are many ways of generating, including using nano particles of water, one molecule thick. I can't do that. We can't do that. We don't have the technology for that. But that's what it is. Okay. Now these are the features of iTeraCare. I will go through the features one by one. It can penetrate, and that's because it can go through this non-polar bodies. That means non-conductors it will pierce through. So some parts of our body are non-conducting. Some parts are. Okay. So that's why it can penetrate. 20 to 30 cm depends on where you point it. Parts where there are lots of water will be absorbed. Parts where there are less water, it can penetrate through. Okay. There are research trying to look for ways whereby you can have a more narrow beam that can penetrate deeper. But this is still in the stage of research at the moment. So if you can penetrate, you can reach the bone marrow. Bone marrow will be pretty tough because bone itself can absorb the terahertz waves. But certainly it can reach the blood vessels deep within your body. Okay. So your blood vessels, your capillaries, which are your small blood vessels, enhances microcirculation, and that's what it does. It causes your blood vessels to open up, and of course when they open up, any water retention will be evacuated. Identification. Now because your cells vibrate at the level, at the same frequency as terahertz wave, other cells don't vibrate at that frequency. So in that sense, it can identify, it can distinguish. And so therefore, different cells are treated differently. So as far as viruses and bacteria are concerned, it kills them by a variety of means. The terahertz wave actually kills them. It's just like heat will kill them. So the heat, that's one aspect. Terahertz wave can create a small, very tiny rise in temperature. That kills the bacteria as well as the viruses. And that's why I got interested in terahertz technology, is because of a scientific paper that say that this is being used, authorized to be used for the treatment of COVID-19 viruses. You see. And they recommend this because this don't need the services of a doctor to do it. A physiotherapist can do it for you. So, yeah, it repairs damages cell. How it does it, I'm going to explain later on. Expelling, we explain that by when you open up the blood vessels, all the unhealthy things are removed, and therefore it unblocks passages, and in this sense it detoxifies your body. Activation regulates the body temperature. That's the correct word. It regulates. Yes, the heat can raise it slightly, but depending on the action, there is an activating as well as a down-regulating response. You find that in the video testimonies, a lot of people have skin things which benefit, especially psoriasis. As you know, psoriasis, or you may not know that psoriasis is an inflammatory disease. One of the inflammatory diseases. The inflammatory cells are overactive. So they produce a lot of chemicals that cause the body to react. Okay? So if they're overactive, you need to tone it down. And the ability of terahertz is it will down-regulate genes that cause all this hyperactivity. And that's the beauty. So the key word is regulate. I won't say it just activates. Yes, it does activate if the cell is not functioning. It activates. It can unzip the chromosomes, so to speak. You know, chromosomes are in pairs. It can open them, and then therefore they become active. They express it. That's a key term. It's easy to use now because the wavelength is short enough, so you don't need a very big machine for it, and you can have something that long enough, and it can generate enough terahertz waves. So because of that, it's very easy to use, easy to operate. You go on the affected part and in uncomfortable areas, and it will work for you. So I'm going to talk about specifically how it will affect you. So because terahertz resonate at the same frequency as your cells, this energy will eliminate abnormal cells or mutated cells, you know, when being absorbed. And that's what exactly happens. You see, it is useful in many illnesses, as I will go through later on. Activate inert cells. It has been found that terahertz can activate cell processes. Okay. For example, those on the skin, you know, your hair can grow faster. You know. My own experience is that my hair used to be growing very well with my anti-prostate medication, which has a component that makes your hair grow like Donald Trump. Donald Trump is supposed to take the same medication. So when I stopped that and I go into this, my hair that used to be dropping because of my stopping of the prosthetic medication, one comb of the hair, one wash of the hair, and you find a huge bunch of hair coming out. So I would have gone bald pretty soon. But when I blow this, I find that, hey, the amount of hair that I lost is much less. Now that is amazing, because I do nothing else to my hair except blow it with terahertz. So it therefore can activate dormant cells and make it to produce. Of course, skin, blood are the most rapidly dividing systems in your body. The systems in your body that don't divide, that divide the least, let's say, are your bones and your heart. So if for the parts of your body that divide rapidly, this has an effect that tells you something. It works, right? If we can activate the bone and the heart, organs that are the least dividing, then it's a miracle. It really can do what it does. So it is very important, and there's evidence that it is able to do so. Self-healing. So there's evidence to say that it can activate DNA. This has been shown. Experimental techniques now, we can actually, under the electron microscope, can actually do that. And in fact, in my days as an expert, I used to be speaking at conferences on medical topics. And the evidence in my area which shows that antidepressants work was to demonstrate that it actually activates the DNA, which produce the chemicals that allow you to recover.
Oh. You need it help you.
Yes.
Antidepressant.
Yeah. Antidepressant does that. There is a lot of experimental evidence that DNA actually enter your nucleus and activate the DNA and cause that to happen.
Oh.
Same with terahertz. Terahertz is able to induce and strengthen the DNA organic molecules. It's able to do so. The experimental evidence is very strong. DNA can be inactive because it's in a double strand. In order to produce, the double strand must open up. Like a ziplock, you've got to unzip, then it's exposed the DNA, and then it began to manufacture the things. So that's what happens. It can do that. You can't believe it, but this is experimental evidence. Okay? In other words, these people who do this have the techniques to enable this to happen. This is science. No fiction. Okay? Believe me, I've been this field, I know. So I want to go through some of the research on various illnesses. First, on the nervous system. Now, nervous system is a very interesting system because nervous system functions on electrical conductivity. Okay, so it's highly conductive. So electrons flowing in and out of the nerve cell all the time. You know, as I move my hand, all the nerves, there are a lot of signals passing to and fro. That's what the nervous system is. So therefore, if it will respond to terahertz. So US study in 2017, patients with dementia showed improvement in memory as well as in mood. They improved their memory. Memory resides in the part of the brain next to the ear, or it's in the center between the two ears, called the hippocampus. Hippocampus is an area that is very rapidly changing. That means if you don't do anything, the cells of the hippocampus begin to die off, especially if you're depressed or you're under stress or whatever. But hippocampus is an area where the cells multiply very rapidly. When does it multiply? When you exercise, when you use your brain, things like that. And in response to certain chemicals, it does. So it improves on that. So that's amazing. And therefore, you can say that this can be used in depression as well. In Tokyo 2019, they showed that amyloid protein it can be broken down by terahertz radiation. What is amyloid protein? You will have dementia. Now, the current understanding of dementia is that it's due to the deposition of amyloid in your nerve cells. This amyloid causes your brain to slow down and eventually die. So amyloid protein is very essential. A lot of research has gone into chemicals that can conserve your amyloid, can conserve your enzyme that destroy the amyloid, cholinesterase, as well as to destroy the amyloid that is produced. I'm not going to go into this because this is very technical, but know that this is a protein we go for if we want to cure dementia. And Tokyo 2019 was able to prove that. The Japanese were able to show that terahertz is able to break down amyloid. And in a clinical study on stroke patients, this is what they found. Increase in blood oxygen volume. If you increase the circulation, of course blood oxygen improves. In stroke, your cells die off because either of blockage or because it's flooded with liquid congestion. So no blood oxygen, no oxygen can go through. So if oxygen increases, then you recover. So you regain consciousness and you improve. Marvelous, isn't it? That's what the evidence shows. How about the heart? Decrease platelet clotting by decreasing platelet count and clotting tendency. In the heart attacks, strokes are all caused by deposits of various things together with the blood clotting that cause a block. In fact, all heart patients, all stroke patients take anti-clotting medication. Right? I'm a heart patient, I take anti-clotting medication every day. That saves me. A friend suggests I should take, what's that? Curcumin. I say, fine. If I don't have a heart attack, I take curcumin. But if I have a heart attack, I take something that I can depend on. So regularly, I take that. I've survived it 20 years already. That's what 20 years is a pretty long time. about 25 or more years ago, I was visiting a scholar at this Stanford. They have a program where they look at heart patients. At that time, we didn't know about cardiac rehab, so they were initiating that. So because I want to work with the cardiac rehab in SGH, so I was sent for this attachment with this Stanford department, and it was amazing. I've been in the medical ward. Every heart patient came in, among us residents, we know within 5-6 weeks, some of these patients will die. In those days, there were nothing. All we know is give some medication and hope that they survive. And sometimes we joke, who will go first? Want to bet who will go first? I mean, it's something to amuse ourselves in such a depressing environment. You see? It was like that. So a patient come in, and they will suddenly collapse and die. And sometimes it's heartbreaking to hear what the relatives say. It's very, very, very traumatic. So if you can decrease the platelet clotting, you can improve. Certainly we have testimonies of people who have their heart variable degree of blockage of their heart or the coronary arteries, and they blow, and after 3 months they survive. I believe that because I know of patients who have heart disease who refuse to go for stent or bypass or whatever, and they manage to survive by doing that. So it's possible. Increase nitric oxide activity in the heart. Nitric oxide is a very interesting chemical. I know about it when Viagra came into being. Viagra, if you remember, was actually a blood pressure medication. And it's effective in blood pressure because nitric oxide opens up your blood vessels. Now, in sexual activity, both in the male and female, nitric oxide opens up the blood vessel, and in the male that sustains the erection of the penis. So it's because of the phosphatase, an enzyme that is blocked. So Viagra is able to block that. And initially, we were told you can't use it in this condition, you can't use it in heart patients and all that. Later on, they found that in heart patients and diabetic patients it's very useful. So Viagra is being given to diabetics and heart patients because it opens up the blood vessels because of its effect on nitric oxide. Nitric oxide is everywhere in your body. It's everywhere, believe me. It's secreted in small amount to be detected. Unless you have very good techniques of detecting it, it has its effect, open up the thing, and then it's destroyed straight away. So because of all this action, there's a decrease in inflammation enzymes and blood flow. Oh, blood vessels open up. That is the effect on the heart. Marvelous. So if you're at risk for heart disease or strokes because of your family history or whatever, blow. Prevent. Prevention is better than cure. Don't wait until you have a heart attack to do it. You see? That's my advice to you. On depression. Okay. In this field, a lot of the study are done in animals. They use markers, behavioral markers, to study the effect on anxiety and depression and so forth. And this is what they found. A decrease in anxiety behavior, a decrease in depression symptoms, and an increase in social interaction. Amazing. If you can affect so many systems, I suppose it makes sense that it will also affect your mental state. The effect is frequency dependent. That means it depends on the frequency. The right frequency it must be. Because the wrong frequency, what happens? It increases depression. So I think this should be noted because a a lot of research must have gone into this because they spent more than six or 7 years, might not be 8 years, isn't it? Deciding which frequency to use, what's the strength, and so forth. How about endocrine glands? Well, increase the potency of antioxidant enzymes such as superoxidase dismutase is able to do so. There are several antioxidants in our body, including the C vitamin, what they call ACE, ACE, vitamin A, C, and E, and increase their potency. Again, you find nitric oxide here again. Nitric oxide is involved in the synthesis of a lot of compounds in the endocrine glands, increasing growth factors and decreasing inflammatory proteins. And this is the part that I was just telling you about in psoriasis, where the inflammatory cells get downregulated. So it causes a decrease in inflammatory proteins. Now, growth factors. It is very important to realize that the body's repair is very unique. The body has stem cells in your bone marrow and within your fat cells. These stem cells promote repair. Say, let's suppose you injured yourself or whatever, stem cells begin to come and start to repair. In fact, those who do cosmetology or cosmetics would know that there is a technique called microabrasion. You heard of it? Where you actually cause microscopic injuries in your skin to stimulate the stem cell production to repair it again. And one person I know, because he has a lot of scarring because of his acne, he do a lot of microabrasion, and he actually got quite a smooth skin after that. But it must be pretty painful for him to do it so vigorously. But people will tolerate for the effects. So that's what it does. The growth factors are cells that allow you, are secreted by stem cells that allow you to repair and to regenerate. Okay? And the growth factors are very interesting. The stem cells stimulate repair, but the stem cell has to be activated by other factors. So for a stem cell to be activated or to be toned down, you need one to activate, one to tone down. For each of this, you need something to switch it on and switch it off. Right? So for each factor, you need two other chemicals one to switch on, one to switch off, and for each of these to switch on and switch off. So it becomes very complex. It becomes a system. And that's why biological system is so interesting. And it's secret of endocrine hormones, subcellular melatonin. Now, who was asking about sleep? You. Okay. THz has the ability to stimulate the production of melatonin, both in the pineal gland, which is for sleep. Melatonin is also produced in the cell. Other parts of the body, cell. And this melatonin has the effect of behaving as one of the best antioxidants your body produces. That's why some people take melatonin for its antioxidant properties. So for jet lag, for sleep in the pineal gland, you would take melatonin of 3 milligrams or maybe 6 milligrams, right? For its antioxidant property, you would take a much higher doses. But because it has an effect on sleep, you don't take it in the day. You'll be sleeping on the wheel and end up facing a tree right in front of you. That kind of thing. You don't do that. But that's what you can do. Very potent. How about cancer cells? Okay, cancer has been one of the growth areas for THz. Okay, it's okay. It's one of the growth areas because of this effect. Okay, cancer cells are different from normal cells in that they tend to have more water. They're more clogged up with water than anything else because the drainage on cancer cells are very poor. Although new vessels will grow around the cancer, it's not always that effective. So because of the different frequency, it disrupts cancer cell proteins. It disrupts them. It disrupts cancer cell DNA, which is important. How we know that? We have the evidence. We know that the difference between cancer cell DNA and your normal cell DNA is something called methylation. The addition of methyl groups to the DNA of your normal cell, which turns it cancerous. And THz is able to demethylate. That means you can remove the methyl group and the cancer cell cannot function anymore. It cannot, because of that, it breaks down. So methylation is an essential mutation of the DNA to allow that to happen. Okay. And also, it is believed that the growth of cancer cell can be suppressed by certain proteins that are secreted, and it stimulates the production of such protein, as well as making the cancer cell more sensitive to anything that you do to kill it. So your radiotherapy will be more effective, your chemotherapy will be more effective. Recently I read the authority, they were saying something like, if your cancer cell is spreading, that shows that whatever you're doing is effective. We tend to think that when cancer spread is bad, right? He's saying it is actually an indication that your cancer cell is losing the battle. How do you tell the difference? Look at your cellular immunity. What kills a cancer cell? Is your T cells, your monocytes and all that. It kills the cancer cells. So if your cancer is spreading, check the cellular immunity level. If it is high, it means that you're winning the battle. Right? Your body is winning. I don't know. I'm not a cancer specialist. This guy says that. I like to hear more news about it before I will say that this is true. But it makes sense. It does make sense. So anyway, what has been studied for as far as THz is concerned? Prostate, breast, skin, lungs, and stomach cancer. And the other thing is, there is a cancer of the skin, you may not know that, called melanoma. Very fierce cancer. If you get it, you go pretty fast. Melanoma is usually on the face. Okay? So pigments like that may or may not be. Any discoloration may or may not be melanoma. And especially when you grow inside, quickly get it biopsy. You can save your life. If you use THz and blow your face, you might be able to nip it in the bud. That's the good news. Osteoarthritis. Now, THz wave is non-luminous. That means you can't see it. Unlike light photons, you can see. THz you can't. So, but it can penetrate. THz is very useful in imaging bone disorders. Why is it very powerful? You know, your bone now, as you get older, you got osteoporosis, right? It becomes, you can see right through. Actually, THz is able to make out different layers within the bone. That's pretty amazing, okay, what it can do. Okay? And when one thing about osteoarthritis is that pain is significantly reduced. This is what we find when we try it on people, right? That pain, tightness usually go off. In osteoarthritis, usually the pain is not always caused by the bone. Sometimes, if your cartilage is worn out, bone on bone is very painful. But most of the time, the bone comes about because your bones are not supported by the ligaments, by your muscles, and everything that surrounds the joint. And so, therefore, it doesn't make sense when you have pain in your joints, important to exercise it. Why? Strengthen your muscle, strengthen your ligaments. My wife has this knee replacement surgery. Initially, walking was difficult after surgery. Much better than before surgery, which was like murder to walk. You know? So I tell her, I said, is your supporting muscles and ligaments. So she exercised. And the more she exercised, the more she can walk. Now she can climb up the stairs of the overhead bridge, which is amazing as far as I am concerned. We recently went to Esplanade to see the jazz bands, and she could walk all the way from Esplanade MRT all the way to theatres on the bay. So it's counterintuitive, but a lot of the pain that is associated with osteoarthritis has to do with muscle and other things. And THz is very effective on that. I think we all know that. If you have done that on any patient, you know. Anybody with joint disorders, you demonstrate with THz is 100% sure. Blow it, it will go away. That's a surer sign. Very powerful endorsement of this. There's also decrease in inflammatory protein. We already say that, right? Inflammatory cells produce a lot of the chemicals that make you do it. And also growth factors that allow you to recover. It decreases muscle spasm. It relaxes the muscle. And that's what you see. People with joint problems shine with THz, you have this effect. Oh, it's backwards, isn't it? Miscellaneous effects on THz wave. So I mentioned just now that THz wave is effective against COVID-19, right? So COVID-19 near infrared, that is infrared that is next to far infrared, has been proven to be effective, and therefore THz wave is also can be effective. It can repair and can regenerate. That's very important because of its effect on the growth factors, and because it downregulates all the inflammatory factors. On the skin, regeneration of collagen, increase in tissues. You go to a plastic surgeon, you want to be more beautiful, especially the fairer sex, they inject collagen, right? Fillers, they call it. That's the effect on the skin. It causes your collagen to regenerate. And when you regenerate, you look better, and there's a tightening effect, so you look younger. That's a wonderful thing about THz. There's a decrease in telomere shortening. I already talked about this just now. Change in DNA expression is switched on. A lot of things which allows for repair get switched on, and so forth. And cancer cells on the skin, the cell died. So skin cancer is one of the most studied as far as the waves is concerned, because it's easily accessible. And because it's easily accessible, you can observe it directly, the effect. And that's wonderful. So it opens up your blood vessels, unblock meridians, and stimulate acupuncture points. Now, acupuncture is based on this concept of meridians, and it is accepted in the West that acupuncture is a recognized treatment. Now, acupuncture is based on this energy that flows, that has a different pathway distinct from the lymphatic. You know, your body fluid drains back to the heart through small canals called lymphatic channels, lymph nodes and so forth, that filter your body fluid before it goes back to the heart. So energy seems to go by a different pathway. At least we know that. And acupuncture works. It's been proven to work in pain, where a certain receptors are involved. It is effective in things like autism. It's been proven. And THz wave seems to mimic the action of acupuncture. That's important. So it can do all this, it can clear. I myself have, when I have problems with my joints, I have consulted acupuncturists, and it's quite amazing. You have but to believe that it works. So there you are. Microcirculation. Now, this is particularly important in the skin. Skin congestion, usually other than direct injury on the spot itself, are caused either by kidney problems or heart problems. It's usually circulatory. Kidney problems, you can't pass out all your fluid, it gets accumulated. Your heart is a pump that brings water all over the place in your body. If it's not working well, you also got jam up. So what happens? It can open up your blood vessels, reduce blood flow, resistance and viscosity, improve your microcirculation, provided your heart is strong enough to move the fluid, your kidney is well enough to aspirate it. Okay? These are important conditions. Because if your kidney is not functioning, you could replace it with an artificial kidney. Dialysis, any form of dialysis will do. Remove the extra fluid and all the excreted products that is unwanted. You see? If your heart is weak, it will not move. You need to get your heart pump working again. It is a medical issue. You need medical treatment, and it's acute. As a young doctor last time, I was in a medical ward, I see all this. See? So it's important, but particularly in conditions like diabetes, which affects both the kidney and the heart. That's why this is so powerful. If you ensure that your kidney and your heart is functioning well, this goes very fast with THz. And you see in the video testimonies, I don't have to convince you that there is a basis for the improvement. So you regulate endocrine glands and protect our organs. Okay, your endocrine glands regulate your entire body. Endocrine glands are so called because they secrete into the blood, directly into the blood. All the hormones that make us who we are, whether we are lively or sluggish, depends on our thyroid. Whether you grow or don't grow depends on your growth hormone. Whether you can use up your sugar in an effective way depends on your pancreas and insulin and so forth. And because of the effect of THz wave, because of the way it regulates our cell, it makes our endocrine glands function properly. You see? So, in that sense, there's a protective effect. And I would want to advocate that we use THz for prevention rather than wait for something to happen and then use it. Particularly if you are reaching the golden years or the silver years or whatever you want to call it. In fact, anybody past 50, I would say you look at your health and look at things that can maintain your health as you go through the final length. Our lifespan was said to be about 76.
No. I say no.
Now it's more.
I will talk to you later. I will explain to you on the cancer cells.
Never mind. Now it has been extended to 80 plus. Why? Because of medical science. We have been able to postpone it. People like me that should have died 20 years ago are alive. People with cancer are still alive because they are powerful medication. They are highly effective with little side effects. And there is a thing. Even our control of chronic disease, heart disease, strokes, and diabetes even. Nowadays, we know that 5G is here, right? You ride in trains that don't have drivers, right? How do the train know where to go, when to turn left and right, when to stop, when to start again? Because of sensors. If we can use sensors on trains, can we not use sensors in our body? We can. There are sensors now that can tell you what's your glucose level is, right? There are sensors that can tell you whether you are making a connection with whoever you're relating to, be that your spouse or your boss. Because if you don't have that chemical, you have another chemical, which means that that relationship is stressing you. So in fact, it's advocated in the Harvard Business Review. Oh, if we have all these sensors on the thing, we can tell whether the boss is relating well to his people or whether he's causing stress to his people. Last time people, I remember I was at a Chamber of Commerce. I don't want to name the chamber. At a Chamber of Commerce meeting, I was giving a talk, and one of the bosses there stood up and said, "Hey, doctor, I'm a good boss. I'm an effective boss because I stress all my workers." Nowadays, that's a different story. If you stress all your workers, you are done. No more effective. So, yeah. So we have sensors for all these things, and there are sensors for your glucose. So if you take your blood glucose and 4 times a day, it's here, 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 right? It doesn't say whether it's going up or going down. It doesn't tell you. Between 2 points, it could be up, inverted V, or proper V, right? That's terribly important because we know the severity of our diabetes depends on the highest sugar level attained. So if I have a sensor, I can tell when it goes high up, when it's a peak like a share price like that, it go up then come down. But if I take the point here and here, I miss it. I miss the high. It's that effective. And that's why our longevity increases. Diabetes, of course, is the product of insulin regulating your sugar, which is an endocrine gland function. Okay? So basically, this is what we say just now. It remove water retention through the various systems. So I will not stay on this slide. Inflammation can be used. Rhinitis, pharyngitis, gastritis, any inflammation. Pains, yes. Very effective for pain. Blockages, yes. Insomnia is counted as a blockages. Skin, yes. Okay? Not recommended. If you are pregnant, you are menstruating, you have disease, acute disease, that means you need medical attention urgently. Very important to say that. People with congenital means abnormal. I am very familiar with autism because of my work, and I can tell you that autism is a disease which this particular gene is not switched on. Okay? And that is a beauty because autism, you can switch the gene by changing the environment. I remember there was a young boy whose parents were very embarrassed and very angry with their child who was autistic, who was about 11, 12, and they abandoned the child. So somebody, I don't know whether it's a friend or relative, took the child up and began to relate to the child and try and encourage the child. Within 6 months, you see the dramatic improvement. So autism is called an epigenetic disease. That means it's a disease where the particular activator gene is not switched on. So if you can switch it on, it will cure, you will respond, social interaction and all that. So that kind of disease is very effective. Implant objects, wound and fracture, don't. So that's my email if you want to talk to me. As we said just now, that THz techniques can be used for diagnosis and for treatment. Okay, you can use it for diagnosis. Can I show you? Yeah. This is a device which is a bioresonance scan. I can't seem to be able to switch it on. See the scan? Scan. Scan.
So what scan is it?
Bioresonance scan.
Also you can see.
You can actually see. So I happen to do this bioresonance scan, and if you are here and you want to scan, let me know. For today only, for people who come here, I'll give you a very generous discount, 50% off. Only for today. If I receive it before midnight tonight, I'll give you this price.
So what things you can see? I mean, after scan,
It's scan. It tells you whether that part of your body is healthy or not.
Oh.
You can send your entire body from top to toe, including your chromosomes.
Oh, okay.
So you will know. You see? So, questions? Any questions?
Yeah.
Yes. Okay.
Okay, just now you mentioned about depressions, right? THz for those with depression. How to blow and then
You blow as for any nervous disorder.
Oh.
Parkinson's, strokes, and you go ahead, the meridians on the back,
Oh.
and so forth. You do that.
So it's like daily blow and about like 20 minutes.
I think it's more than that.
More than
You
that.
probably, my brother has a very severe stroke. He did it for 2 hours every day.
2 hours every day, but
That
like
means
blow
broken
then
up lah.
stop. Oh, broken up lah.
Yeah.
So a few sessions. Okay.
But I think you can start off with at least half an hour to 1 hour, depending how much you can tolerate. At least, you know. It should be effective because that's what they have shown.
Excuse me.
Yeah.
I think you are wrong. Even though your daughter, you do not know how to answer. I explain to you about cancer cells. Okay? I teach many people. Many people have survived. Many people have survived through my testimony. I telling people, many people down the road. How many people tell? Hundreds of thousands of people tell. You listen carefully what I say. You refer back. Can you turn back on the cancer cells?
Yeah.
Cancer cells, refer back the cancer cells. Cancer cells, no. Okay,